Good morning, and thanks for inviting us here today. I am Jim Tileman. I'm the Secretary-Treasurer of the Ohio Education Association and an English teacher in the Howell Local School District located in Warren in Northeast Ohio with 31 years experience in the classroom. I'm here on behalf of the members of the Ohio Education Association to voice our concern for the McCain Health Plan. For OEA members who work in Ohio schools every day, the detriments of this proposal are clear. Astoundingly, McCain wants to tax health care benefits of employees, meaning middle-class families now covered by health insurance at work would pay new taxes on up to $20,000 in benefits for a family or up to $10,000 for a single individual. That's right. This is a tax increase for our teachers, support professionals, and the entire middle class. The McCain plan will deregulate the healthcare industry, just as previous legislation he supported deregulated the financial services industry. It will force millions of Americans into a deregulated individual market, stripped of consumer protections, where they will be at the mercy of the big insurance companies. Our healthcare system problems are deep. There are 46 million people without insurance. Costs are rising and becoming increasingly unaffordable, and the quality of care is inconsistent. And Senator McCain's plan would worsen the problem, creating a deregulated insurance market, leaving Ohioans with serious illness without insurance coverage, and millions more paying higher taxes for their insurance coverage. This plan would adversely affect our students too. It stands to have major consequences for the health and well-being of children and their involvement in the learning process. It goes without saying that kids get sick at one time or another. When they do, it's best if they can see a doctor for treatment. But without health care insurance, parents will have to make the difficult choice between paying bills or seeking health care for their children. As a result, students may likely come to school when they are too ill to be active participants in the classroom, and also risk spreading illness to other classmates and others. The OEA strongly opposes the McCain Health Plan. It is wrong. It is the wrong thing to do for Ohio students, parents, and public school employees. And just as a side note, as I read the report, I was really intrigued by the line that characterized the plan as tossing a 5-foot rope into a 10-foot hole. I think that adequately frames what goes on with this plan. Thank you.
And we now have sort of the setup to our closer. We have Nikki Rigano from UFCW. She's an assistant customer service person at the UFCW. And if she would come up and address us.
My name is Nikki Rigano, and I am an assistant customer service coordinator for Kroger in New Albany, Ohio. I'm also a 17-year member of the United Food and Commercial Workers Union, Local 1059. I use my health care plan provided by my employer, mainly for preventative care. For the most part, I'm a healthy person, and I'm able to stay that way because my health care is affordable. However, in my quest to stay healthy and active, I have sustained sports-related injuries in the past. The bills from my tests, x-rays, MRIs, and physical therapy were unreal to me. The health insurance that my union bargains for and that my employer receives tax incentives to provide has covered the majority of my expenses. My concerns with the McCain plan are simple. If my health care costs rise, will I be able to afford health care, maintain a savings account, and still pursue my American dream of owning a home? For me, all three concerns are linked. If my health care costs rise under health care tax, the less I will be able to save, and that means the pursuit of my American dream of being a homeowner may not be a reality at all. I'm not only concerned for myself, but for my family, friends, and my coworkers. If they are struggling with healthcare costs now, what does this plan mean for them? John McCain's plan to establish a brand new health tax would be irresponsible during the best of times. And during an economic crisis, it threatens the well-being of middle-class families everywhere. Instead of creating new taxes, he should be helping hardworking Americans keep the tools they need to stay healthy. Putting affordable, quality health care coverage out of reach more than 900,000 Ohioans is simply not an acceptable option. The McCain plan will leave tens of millions of Americans with health problems searching for adequate and affordable health coverage. I have a coworker who's had a heart transplant. He's very young. I have another coworker who needs a kidney transplant. These healthcare needs are normal for working families. My question is, where does the McCain plan and his healthcare tax leave them?
And our final speaker before questions, I've known Mary Jo Kilroy for a long time. And I can tell you one of the first conversations I had with her on my Oak Street, back when I lived in Clintonville, was on my front porch when she was a school board candidate, and it was about quality, affordable health care. This is a longtime advocate for quality, affordable health care, who is a county commissioner, continues to advocate in that manner. And I would like to invite her up to talk to us about her experiences with Oak Street. Thank you.
Thank you, everyone. I think it's very important that we shed light on all the health proposals that are coming forward. And this one in particular is extremely disappointing, because once again, we see healthcare policy directed at the healthiest and the wealthiest, and not at the many who are either struggling to provide health care for their employers or trying to buy health care in the marketplace. As county commissioner, I've talked to a lot of people, talked to a lot of small businesses, some of whom do provide health care for their employees. And I'm really concerned that this proposal, if it was adopted, would be the tipping point where they would say, I'm sorry, I can't do it anymore. Or it would be a tipping point for the employees who are now seeing their salaries get eaten even more by being taxed for a benefit that previously was not a taxable benefit. Putting the tax burden on these people seems to be the wrong direction to go. But I'm very concerned because as county commissioner, I have worked to try to provide a health care safety net for those people who don't qualify for public benefits and whose employers don't provide health care benefits for them, the uninsured in this community. So you say, well, wouldn't a tax credit help those people? I don't believe that it will. And the biggest reason is one word, or two words rather, pre-existing conditions. Those pre-existing conditions eliminate a lot of people from even using that tax credit. I've talked to, for example, an ophthalmologist in this community who had a small practice, a small business. And at a relatively young age, in his 50s, he had a stroke, and it affected his vision. Because of that, he sold his practice. And he thought, no problem, I'll go out in the market, I'll buy health insurance. Guess what? He couldn't. They will not insure him. And when I think about people in my family, I know how hard that pre-existing condition will hit. That tax credit won't help them because pre-existing conditions will bar them from even buying health insurance. Or I think about young people starting off, leaving college, getting removed from their parents' health care plans that maybe their parent has to work as a state employee or in the private market. They get thrown off there, maybe they don't have a job yet that will offer health benefits. Will that tax credit help them? I don't think so. Because I don't think they'll earn enough, even if they might be healthy enough. They won't earn enough to be able to buy that COBRA insurance. And that tax credit won't be enough to help them get there. So there are serious problems, and the thought of adding more people to the ranks of the uninsured is a serious issue for our country and for our state and for our Central Ohio community here. What we need to do is to work to find health care plans that won't add to the number of people who will lose their health care, but will instead address that and help bring more health care to make it affordable and accessible to more of us in Ohio. And with insurance premiums continuing to go up, adding people to the ranks of the uninsured is a public policy problem for everybody at every level of government, and it's a serious issue for us here in Franklin County. So, thank you, everybody.